Hello, Sarah Jane here. I am just checking I'm live. If you're tuning in, let me know you're there. Hopefully you can hear me okay. I'm just going to check that everything's working fine. And that Sarah Jane here. I am just checking I'm live. If you're tuning in. Yeah, all looks good. Okay, so welcome. I'm in clinic today. I just had seen a patient there. But what I wanted to do in this live was go through some of the treatment options that we offer in our clinic in Glasgow. So we are MSK specialists, podiatrists, and we sit within TYPP, which is a big yoga Pilates studio in Glasgow. So within the studio, we have all the big reformers. So if you can see, if I just turn this camera that way, you can see that's a reformer just over there in the clinic room. So that's the studio side of things, but I'll do that in another video. I myself am a Pilates teacher, been a Pilates teacher for the last, probably about 22 years now. It's frightening. And as well as that, I'm an MSK podiatrist and I'm also a sports therapist. So we offer a whole range of different modalities here. And I wanted to go through, just you can see here in this screen, just some of the soft tissue treatments that we offer within the clinic. So I'm going to just pull up the website to remind me of all, so I don't forget, just so I get through them all. And if you have any questions about soft tissue body work and what that is and what it can help with, just fire away, ask. So I'm going to kind of debunk some of the things that are on this trolley, because many of you come in and see all these things and what is all that? What do you do with that? So we offer loads of different treatments, right? I've got them all up just so I don't forget. We offer lots of different treatments. So from obviously the podiatrist side of things, we've got nail surgery, we can help with any tendon problems, MSK problems, to customised orthotic fitting. We've got over this side of the room, if you can see, we have SIDAS, where we can make and mould the insoles. We mould the insoles on this thing here. So we have a whole array of different treatment options. We have laser therapy, we have shockwave for tendons or inflammation, got that all covered. But there's a whole other host of other things that we have in terms of a wee bit maybe less invasive than shockwave. And this comes under our soft tissue therapy. So as I said, we're also sports therapists as well as healthcare professional podiatrists, specialising in injuries, basically specialising in getting you out of pain. So let's go through kind of what's on this table. Yeah, I'm trying to get this camera the best angle. How's that? So I can get things on there. So essentially, what we've got here is, first things first, is this. What is this? So this is myofascial release wax. So very rarely in clinic do I use like a lotion. I haven't even got it on my thing. So in here, I'll sometimes use a cooling gel if I'm working, maybe working the calves, maybe we've done some release of the hamstrings, whatever it is. So maybe we're just trying to calm everything down. So I might use the cooling gel, but that can be quite slidey and sometimes it isn't great for getting that kind of purchase of the tissue. You don't always want your hands to slide too much when you're doing a lot of soft tissue work. So I tend to use this Songbird myofascial release wax, and it's a wax base. I'll show you. So essentially, if you're coming in to see us and we're doing, say you've maybe got plantar fasciopathy, within your treatment, there'll usually be some amount of soft tissue therapy in that as well. So meaning that we are using different modalities to help release the tissue. So we might be also working into your calf muscles, into your hamstrings, as well as dealing with your plantar fasciopathy. So we tend to use the Songbird wax, and it actually, you need a tiny wee amount of this, and it just creates a little sheen, and it allows us to nicely glide along the tissue without sliding along the tissue, because a lot of the things that we might be doing with you, we need a purchase of the tissue rather than like a massage where we're just rubbing you down and we're working into the tissues. So that's the modality we usually will use, usually Songbird wax, usually. Also in here, we've got things like kind of heat lotions, we sometimes use like deep heat, and we also get a lot of clients that love tiger balm and things. So we'll sometimes use some heat in the area. Sometimes we'll use heat, actual kind of like wheat packs that will heat up if we're wanting to really, really calm and say your muscles in a spasm. So we'll sometimes use things like that as well. Also in here is the instrument-assisted massage tools. So that looks a wee bit scary, doesn't it? It's like, what are you going to do with that, SJ? But this is essentially just a massage tool. So if you imagine it's curved, it's got pointy bits if we wanted to do more trigger point release. So if you imagine on your tissue, we are utilising this tool to release the tissue. It's more kind of myofascia. So that's what that is. And we get different sizes of these, so small ones, big ones. It looks worse than it actually is. So let's bring up the cups. These are always a talking point. You've probably seen some of this with the Olympics and stuff. You've probably seen the remnants of people. I'm just checking there's quite a few of you on. So if you have any questions, do just ask me. You've probably seen a lot of the athletes with the cups and stuff, the big suction marks around them, and this is generally what they've had. So they come in many different sizes, and they're basically vacuum cups. So generally what I'll do with these is, for me, it's more about creating a kind of a release of the tissue. But there's many practitioners, and there's probably research on there, but it's not great research. But essentially, with a lot of the cups, they'll say that it's drawing toxins out your body. Whether it is or whether it isn't, that isn't really why I would use it. It's more about getting the tissue restoring function, essentially. So if you imagine if you had, again, plantar fasciopathy, I might actually use some of the smaller cups on the tissue of your feet. I would be utilising that. And what we would do is essentially, I think it's a smaller one, I'll show you. We'd essentially put the cup on to wherever we want it to be, try and get somewhere where it's going to stay. And then we essentially suck the air out of it, utilising this. And you can see how I can draw that up, okay? You can see how my skin's got into that. We can leave them on if we just want that kind of decompression effect, but usually what I do is I'll have down this end, so if I was doing an arm, I would be moving the arm and getting the tissue to move underneath it. Other things that I would do with that is actually glide, so kind of doing this, but once I've got my massage medium on, I would be gliding the tissue. I would be utilising the cups to glide up and down the tissue. Great for kind of myofascial release, and again, just really restoring function. So cups are something that would be used usually within a treatment. Not every treatment, it's just something else that's there. There's many tools in a toolbox, but cupping is something that on a daily basis I use. And then we also have rock tape cups. So these are a wee bit different to the ones that I've just shown you. Rock tape cups, it's quite hard to say, come in two different sizes. So there's the black and the red. The red are smaller. Now, essentially what we do with these, very, very much utilised when you're doing functional movement, right? So if I have somebody that's come in and they've got maybe pain in their hamstrings, pain in their knees, I would apply these cups and then I would have them standing up and moving with it. So I'd be taking them through the movements that were causing pain with the cups on. So these, usually when you're up and about and moving, are the kind of cups that we would use. Whereas these ones, usually you're on a treatment bed and we're using these ones, and we're usually, it's not that you'll just be lying there doing nothing, you'll no doubt be asked to move a part of your body, whatever we're working on. But with these, the rock tape ones, they're much more functional. They go on, basically we don't need the suction gun. We essentially just push it down and it goes on like that. And then essentially from there, I can be moving and doing whatever I'm doing, whatever I'm trying to restore. So that's the rock tape ones. We also have electro stimulus that we use, so things like TENS, and we also, and I'll show you in a second, our medical dry needling. So needles usually freak people out, right? So this is our kidney pot. This is a bin for needles, so essentially a sharps bin. This is where the little needles go when we're finished with them. So in here is where the stuff, if I take that down so I can see that a wee bit better. So in this area here is the area where we keep all the needly type stuff. So the first thing that we would do when we're needling is prepare the area, so we're not putting any germs into your body, because we will be breaking the skin. So we clean the area. Needling, we can do needling anywhere in your body. Needling is essentially pro-inflammatory. So it kind of works similar to, I suppose, what shockwave is doing, where you're increasing that inflammatory response to the area. So great for tendons, great for releasing trigger points. And we can do this both with the electro stimulus or without. And trigger point needles come in various different sizes. They are clearly all single use. This is what they look like. These ones are a wee bit bigger. I say a wee bit bigger. These are 50 millimetre, and these ones are, let's see, these are 25 millimetre, so half the size. Okay, so they're single use, they're not used in anywhere else. Once we're finished with the needles, we would pop them into the little sharp fin. The gallipots we usually have where we've got needles ready and prepared, right? So if I show you, so needles usually come with a little applicator like so, and then this is just a wee plastic part that kind of helps keep the needle in place. So there's a little needle in there, and then we would have palpated and found where we want to put the needle, and we would essentially put it on. I'll not put that into myself because my skin's not prepped, and essentially we would just release this, tap on the end of the needle and pop it in, and it really isn't sore, right? But essentially I would just tap on that and it would pop the needle in, but I wouldn't do it because I've not prepped my skin. I'll show you what the needle looks like. I don't know if you can see that in the camera. Okay, so this will obviously get in the sharp spin once I'm done. That's roughly what they look like. This one's a kind of a metal end. You can get ones that are kind of plastic end as well. These are great for the electrical stimulus. So that's your sharps. Medical dry needling. It really is not that exciting, really, but everybody kind of freaks out by it. It's quite good. You get quite good results from dry needling. Things like your muscles are in spasms, tendon. I'd probably use shockwave or a tendon more than I would do dry needling, but it just depends. It depends on each patient, but it works in the same mechanisms. Essentially, you're getting more blood flow to the area. That's what your dry needling is doing there. The other thing that we can do with the medical dry needling is get your muscles out of spasm. So we can, it's very quick. So essentially you're in and out with them. It's not like acupuncture where we're looking for acupuncture points and leaving them in for ages. They're literally 15 seconds and most of them are out. So great for trigger points, great for desensitizing muscles, great for pain management. It really works great. Right, what else we've got in this? So we've got down the very bottom, I'll bring up this one, is our taping. Our taping tub. We use rock tape in here. Rock tape's just a brand of kinesiology taping. A really good brand, so I would recommend that. Generally what we try and do with our patients in here is, if they need to be taped up, if they need their tissues to be supported, we teach them then how to apply it themselves, and we sell the rock tape in here as well so that they can go home and manage their symptoms as well, because the tape will usually last 5 to 7 days. Rock tape, a good quality tape, will usually last that. But essentially, the tape works really well because so for plantar fasciitis, fasciopathy, we're essentially supporting the tissues there, we're offloading it. We can use it for compressions because we know with compression we can get a release of pain. We can use it to support any tissues, knees, tracking, posture tape to remind people of posture positions. We can use it for reduction of swelling, edema, loads of different things. So that's your kind of rock tape. I also love the rainbow ones. How beautiful is that? It's rainbow rock tape. But we also use different type of tape, like this is zinc oxide. So this is different to the kinesiology tape. It's got no give in it. So if I show you that, it's like really, really dense, right? Whereas if I take a wee bit of kinesiology tape, I'll show you. I mean, right, here's a wee that bit. So kinesiology tape is very flexible, right? So you can see how that stretches. And that's really the science behind when you're putting kinesiology tape on, is getting the right tension of what you're trying to do, basically. So it's not really, there's an art form to applying the tape. Whereas zinc oxide doesn't have any give, right? It's rigid. So with this sort of stuff, we might use this. Say, for example, you come in, you'd sprained your ankle or something. We don't want any movement. We just need to support you. We would do that. Sometimes, if you're in a really acute plantar fasciitis, we would use zinc oxide to really just offload you, because we don't. With kinesiology tape, it will work with your muscles, tendons, and ligaments, and it offers a degree of support, but it's facilitating movement, whereas the zinc oxide is basically holding you still. I think that is that in that one. Let me check that I've not missed. We've got like some cold gel, cooling spray. We've got some rock sauce. This is, again, it's just like cooling. So for more of a kind of an acute injury, we were trying to reduce pain, inflammation. We'd use that. So that's the kind of soft tissue. It's always great. I always find it quite interesting looking at, what are all these things. I'm just checking I've not missed anything. So yeah, that's soft tissue. So from medical dry needling to manual mobilization therapy, to taping, to cupping therapy. I didn't mention muscle energy techniques. So we don't really use a modality for muscle energy techniques. Muscle energy techniques is a technique where we are utilizing the nervous system in a way to essentially get better. Essentially, you're tricking the nervous system to allow, say, for example, your muscles went into a spasm and it wasn't facilitating a certain motion, a certain movement. And we know that we need to get movement in the joint. And what we can do, sometimes when muscles are restricting motion, what we can do is that gives us power. We've got power over that. So we can utilize the nervous system where we have a contraction, and then we have a window of opportunity where the nervous system is essentially desensitized. It allows us to trick the nervous system and not have the muscles go straight into that contraction again to protect. So we have about a 20-25 second window to move the joint into a new position, and for the muscle spindles to basically recognise that there's no danger, and then it trains the nervous system that there's no danger there. So that's kind of theory behind muscle energy techniques, that you are utilising the nervous system to facilitate movement. So they can be really, really good. I use them in pretty much most patients that come in, even if you were coming in to see me with, say it was something as simple as plantar fasciopathy, I would probably in some form be utilising a muscle energy technique when I do my manual therapy. So when you're coming in to see us in our clinic, we utilise a lot of different modalities based on, it isn't a case of saying, this is what we use. We're going to do some soft tissue work, or we're going to recommend shockwave, or we're going to recommend laser, or we're going to use the instrument-assisted massage tools, or we're going to release your fascia, or we're going to use cupping, or we're going to use dry needling. The reality is that every patient is different, and having these tools at our disposal just essentially gives us more tools in our toolbox that allow us to choose the right tool for what you need. So no matter what your condition is, how you're treated, and in terms of what tools we use may differ to somebody who had a similar presentation. But one thing that I should say is that the stuff that we're doing to use, the stuff in here where we're utilising these modalities, is only part of the management plan. A big part of your management is your rehabilitation. We obviously are giving you advice on how to stop the problem, stop the issue, get out of the pain, deal with the injury. And part of your plan with us is rehabilitation as well. Okay, so it isn't just a case of you come and you lie on the plinth and we do stuff to you and that's it. There's a whole plan there behind getting you out of whatever condition or whatever injury it is that you've got. So that was just to show you around this trolley. That's what we kind of say is the soft tissue trolley, soft tissue modalities, cupping, your medical acupuncture, your electroacupuncture, your taping, soft tissue therapy, and we have the use of the instrument-assisted massage tools. Should say we also use a Theragun in here as well. It's way over there. I'll not go over and get it. I'm sure you've all seen Theraguns before, but we have, we'll sometimes use Theraguns. Sometimes quite nice at the end of a treatment, just it's almost like a little treat. So let's just say when you come in and see us, you leave feeling good. It feels nice after you've come and seen us. So if you have any questions on any of the modalities that we spoke about there, don't hesitate to ask. And if you would like an appointment, I'll put the links and stuff in with this. We're based in Kinning Park in Glasgow. I'll see you all later. Bye.